Good afternoon, everybody. Thank you yet again to all of you for joining us for this daily briefing. I want to start, as usual, with an update on some of the key statistics in relation to COVID-19 in Scotland. And as was the case last Wednesday, today's will have two parts. Firstly, I'll give an update of the daily figures that you are used to hearing me present at these briefings. And secondly, I'll give a summary of the key points from the latest weekly publication from National Records of Scotland. That does mean my update today will be a little bit more complex than usual, but please bear with me. Let me turn firstly to the daily figures. That is the number of confirmed cases, the numbers of people who are in hospital and intensive care, and the number of deaths that have been registered in the last 24 hours of people who had tested positive for the virus. As at 9 o'clock this morning, I can report that there have been 6,748 positive cases confirmed. That's an increase of 390 from the figures reported yesterday. A total of 1,748 patients are currently in hospital with either suspected or confirmed COVID-19. That is a decrease of 53 from yesterday's figures. And a total of 195 people as of last night were in intensive care with confirmed or suspected cases of the virus, and that is a decrease of 1 on yesterday's figures. Now, as I said yesterday, these hospital and intensive care figures do give us cause for some very cautious optimism at this stage. But I want to caution again that it is still too early for us to be definitive about that. So my caution is not against cautious optimism, but against reading too much into these figures at this point. Not least because in the last 24 hours, I'm afraid that 84 deaths have been registered of patients who had been confirmed as having COVID-19. That takes the total number of deaths in Scotland as of 9 a.m. this morning under that measurement, and I'll come on to explain that a bit more in a moment, to 699. I would remind you, though, that as I've said over the last couple of days, death registration is likely to have been lower over the Easter weekend, which means that the figures we have reported in the past couple of days may have been artificially lower because of that. So today's higher figure will in part be a reflection of that. Now, I spoke last week about the way in which we are recording deaths caused by COVID-19. For our daily update figure, the one that you've just heard me give, the one I give every day, we report on deaths registered where the individual who has sadly died had been tested and confirmed through that test as having had the virus. Those figures are the most accurate ones that we are able to provide on a daily basis, but they don't capture all deaths from or related to this virus. So National Records of Scotland, or NRS, began last week to publish each Wednesday a new weekly report. And this weekly report captures all deaths registered within a 7-day period ending on the preceding Sunday. And this includes not just those people who've died having had a confirmed laboratory diagnosis of COVID-19, but it also includes deaths which are presumed to be linked to the virus. So it includes cases where COVID-19 is entered on the death certificate as a suspected cause of death or as a contributory factor in someone's death, but where no formal test had been carried out. The number of deaths that will be reported under this system is therefore larger than under the daily system when you compare the two figures on the same dates. But it is a comprehensive figure and therefore obviously a more accurate one. NRS published the second of these weekly reports today, just about half an hour ago. It covers a period up to Sunday, the 12th of April, just 3 days ago. And let me remind you that at that point, we reported a total of 566 registered deaths of people who had tested positive. However, today's report shows that by Sunday, the total number of registered deaths linked to the virus, confirmed and presumed, was 962. 608 of those were registered in the 7 days up to the 12th of April. Now, I am acutely aware that this information is really hard to hear. It is also very hard to report on. These numbers are higher than anybody would ever want to think about. But we do need this fuller information to understand the toll that this virus is having, how and where the virus is progressing, and also to inform what we do next. There are three other points that I want to highlight about these figures. The first is that they provide further breakdown of the numbers who have died, breakdowns according to health board, area, sex and age. And for the first time, this week's report provides information about the setting in which people died. They show that 596 of these deaths as of Sunday were in hospitals, 237 took place in care homes, and 129 happened at home or in some other setting. And I want to say more, particularly today, about the 237 deaths, that's almost 25% of the total, that had occurred in care homes up until Sunday. We know that older people are more at risk of becoming seriously unwell or dying from this virus, although I should stress people of all ages are at risk. And we also know that care homes can be places that are more susceptible to infection outbreaks. Care Inspectorate figures to be published daily by the Scottish Government from now on show that 433 care homes have so far recorded incidents of coronavirus since this epidemic began. So I want to stress again today how hard we are working and will continue to work with care home providers, local health protection teams and the Care Inspectorate to ensure that care home staff and residents have the support and equipment that they need. I also want to make very clear, this shouldn't need said, but I want to say it, that the residents of care homes matter every bit as much to us as people in the community or in hospital. It is just as important in care homes as it is anywhere else. In fact, I would say it is more important, given their vulnerability and susceptibility to infection spreading, that we do all we can to prevent infection and also to control it when there is infection in a care home. The role of testing in this has also been raised. We already test the first residents in any care home who become symptomatic of coronavirus in order to establish the presence of the virus in that home and then ensure that all appropriate measures are taken to protect all residents. However, we're moving now to test all symptomatic patients in care homes. The CMO can say more about this if there are questions later. But his advice to me is that while this is not strictly necessary for, nor will it change the clinical management of cases in care homes, it is nevertheless important for the confidence of relatives, staff and the wider public, given the vulnerability of care homes. But let me also stress that guidance to care homes is already very clear about isolation and social distancing, and that remains the most important factor in making sure that we're managing and preventing infections in care homes. Second point I want to make about these weekly figures is that the overall number of deaths registered last week is again much higher than the average for the same week in previous years. And while this week most of that can be attributed directly to COVID-19, not all of it can. And that issue, as we talked about last week, is one which has been observed in other countries. It is a very serious issue for us to look into and explore further. And as our understanding of this develops, we intend to publish more information about it in future reports that we'll talk about at these briefings. And the third point is that these figures record deaths, as I've said, according to the date on which a death is registered. While registration normally happens reasonably quickly within 3 days, there can be a gap of up to 8 days between somebody dying and the death being registered. And because of this, we can't publish information by the date of someone's death, as we would like to do right up until the 12th of April. NRS has, however, published this information, which is the number of deaths by date of people dying rather than date of death registration, for the period up to the 5th of April. And while this is not quite as up to date as the other figures we're talking about today, it still gives us a more accurate picture of the spread of the virus to this point. Now, I focus on the statistics in these updates because they are really important. They give some overall sense of how the virus is spreading. And at a briefing like today's, the statistics do need some explanation. But I am always aware, I am always very acutely aware, standing here, that each death is not just a statistic. Every single one represents a unique, irreplaceable individual, and we should always keep that in mind. I want once again to express my condolences to everybody who has lost a friend, a family member or a loved one to this virus. I also want to acknowledge that listening to these figures and statistics is hard and it is horrible. It's hard and horrible to stand here talking about them. And I know that it can also make you feel powerless, that something we can't see is claiming so many lives amongst us. But the point I want to stress, as I always do, is that none of us are powerless. All of us have some control here. By following the rules, by staying home, by self-isolating when we have symptoms, all of us can help to reduce the number of deaths. I have one other issue I want to briefly update on today before I hand over to others and take questions, and that relates to our support for businesses. We've reflected often that what is a health crisis has become an economic crisis, and that we must also do everything we can to support businesses and the economy, because jobs and living standards, prosperity and ultimately our health all depends on that. Today the Finance Secretary has announced measures worth a further £220 million to help companies which are affected by this pandemic. £120 million of that will allow us to widen eligibility for the small business grant in order to help businesses with more than one rateable property, in addition to being able to claim a grant of up to £10,000 or for some businesses £25,000 for one property. These businesses will now be able to apply for grants up to 75% of that for each subsequent property that they own. And that is a measure that directly addresses a concern that businesses had expressed to us. In addition, a further £100 million will target people who might not currently be eligible for other forms of support, either from the Scottish Government or from the UK Government. So it will be open to self-employed people, particularly newly self-employed people who are suffering hardship and are ineligible for the UK scheme, and also to smaller companies who simply can't wait for other sources of support to take effect, or who again might be ineligible for other schemes. This funding will be open for applications no later than the end of this month. We will publish further details on eligibility in the coming days and as soon as possible. These measures, if they are taken up in full, as I would expect them to be, mean that the overall support for business offered by the Scottish Government will actually exceed now the £2.2 billion of budget consequentials that we received and which were so welcome from the UK Government's package of support. They are a direct response to feedback from businesses, and they, I hope, demonstrate our determination to support to the maximum we possibly can businesses across the country which are suffering through no fault of their own. And I hope it demonstrates as well our willingness to listen and to always seek to respond to concerns that are expressed. Before I hand over to the Interim Chief Medical Officer, I just want to end by repeating the key public health rules. Other than for a few very specific reasons, such as exercise or buying essential goods, you should stay at home. You should not be going out. You should stay 2 metres apart from other people when you do go out for essential purposes. You should not meet up with people from other households, and if you or others in your household have symptoms of COVID-19, you should be isolating completely. You should not be going out at all, even for essential purposes. Now, I know how difficult these rules are, and I've taken a bit longer to go through this update today, but the figures I've read out, some of them showing signs for cautious optimism, but others still deeply distressing. These figures demonstrate just how important it is that we all continue to follow these rules. They are making a difference, and they will continue to make a difference. And they will hopefully bring much closer the time when we can start to get our lives and the country back to normal. So thank you once again to each and every one of you for doing the right thing and sticking with these rules, because by doing this, we are all helping to slow the virus, save lives, and protect the National Health Service from being overwhelmed. So thank you sincerely to all of you. I'll now hand over to Dr Gregor Smith, the Interim CMO, who's going to say a few more words before I hand to the Health Secretary.
Thank you, First Minister. So the First Minister has spoken today about the toll that coronavirus is having on our population, and we see that very starkly in the figures that have been reported by NRS today. That's why, once again, I emphasise it's so important the need to comply with the social isolation and distancing measures that are in place. And once again, I make this appeal to each one of you to continue to do so. I know that this isn't easy, and I know that it isn't without impact in your own lives, but let me assure you that it is very necessary at this time to continue to do so. I want to also express my own condolences to those who have lost loved ones and friends, and ask everyone to remain resolute in their behaviours and their actions to limit further losses by complying with these measures that we've outlined once again today. The figures emphasise that older people are more vulnerable, But as First Minister has also said, we are all vulnerable and must work together as a society to do all we can to reduce the level of risk and to try to prevent exposure to this virus. That's why the shielding and social distancing measures are in place, and I want to thank everyone for continuing to comply with these measures. I understand once again the burden that this brings. These figures also show the impact that this virus can have in places like care homes. I continue to speak with health protection teams and clinicians across the country to try to make sure that their response to these outbreaks as they occur in care homes are everything that they should be and are maximised. Once again, I've emphasised to them my expectations about how they will provide support to care homes who are experiencing outbreaks of these cases. And I know that across the country, staff in care homes are providing very dedicated and high-quality care, but I want them to feel supported by their local clinical teams too. I've spoken before about my time as a GP, and one of the most important relationships that we had in the practice was with our local care homes, where we recognised the vulnerability of that population that lived as in their house, their care home as their house, even in better times. Across the country, I know that GPs will continue to provide support to those care homes, and I appeal to fellow colleagues just to make sure that the way that they're providing that support is done with the utmost of sensitivity and that they're reacting to the situation in the way that all of us as clinicians would feel appropriate to do so.
Thank you, Gregor, and I'll hand over now to the Cabinet Secretary, who will cover a couple of other issues.
Thank you very much, First Minister. I want to just speak very briefly about some additional work that is underway with respect to residents and to our care homes. Let me also restate what the First Minister and Dr Smith have said about just how much residents in our care homes matter, as well as those who are living at home and patients in our hospital. And that's why we undertook the additional work that I've spoken about before in order to ensure that care homes have all that they need in terms of PPE, with that direct order route now to our national stockpile and that direct distribution route. It's why we take so seriously the concerns and the issues that are raised directly with me from Scottish Care, who represent a significant proportion of those independent care homes across the country. And we will continue to do that. We've had taken steps to provide further assurance. First Minister has spoken about testing. I also want to add that we have now asked our public health directors to take forward a local leadership role, harnessing what Dr Smith has said there about the primary care teams and the health protection teams to ensure that we can offer the maximum support, both in terms of clinical support, but also infection prevention and control to individual care homes right across the country. There's over 1,000 of them, and our work will intend to provide support to every single one of those. There will be more steps that we will take that we are finalising at this point, and when all of that has come together, then I will be very happy to come back and set those out for you.
Thank you, Cabinet Secretary. I'm going to move straight into questions now. As usual, we've got a long list, but we will get through all of them. Jim Matthews from Sky.
Thank you very much, First Minister. You have spoken about care homes, about maximum support. Care homes, I can tell you, at least one major care home provider, since your announcement, has said this is too little, too late. He's got 15 care homes, 1,100 staff. Of those, 23 have been tested. 700 residents. Of those, 7 have been tested. Can you give me your figures for residents and staff in care homes and tell me how many have been tested thus far, given that you acknowledge now the importance of testing?
So when I give figures here, I want to make sure those figures are robust. We are providing already in Scotland, I think, more up-to-date information than anywhere else, and it's important that we do so. So I know that over 8,000 NHS and care staff have been tested. As soon as we have a robust, reliable breakdown of that, we will report that as well. On residents, I'm going to hand over to the Chief Medical Officer in a moment on the issues around testing with residents. it's important that as we have built up capacity, we've used testing generally in the most effective way. In care homes, the most important use of testing has been to establish whether the virus is in a care home, to then allow that situation to be managed properly and proper infection control measures to be in place. As I said earlier on, moving to test more symptomatic residents, all symptomatic residents, doesn't change that clinical approach, but it is about continuing to build confidence. We have very clear guidance in place for care homes, which care home providers, I don't know which care home provider you're quoting, we're very happy to engage and are engaging with all care home providers who of course have responsibilities to make sure that the guidance within their own care homes with the relevant support from health protection teams and the inspectorate is being properly implemented. So I know how much focused hard work is going into this, and it's right that that is the case, because we know how vulnerable older people are and we know how susceptible care homes are to infection spread. So this is an area where there is already significant work being done, and that will continue. I'm going to ask the CMO to say a word or two more about testing in terms of symptomatic residents, bearing in mind that we will be providing further information as soon as we can about numbers of care home workers who have gone through testing.
So I think it's very important to make sure that we're all clear on the role that testing has to play in this, and I would emphasise again that the guidance has been available to care homes and clinical teams even from before the first case in care homes has been reported. The absolute backbone of management within care homes has got to be around about shielding those who are most vulnerable and making sure that those infection prevention and control measures that are in place are everything that they can be as well, that's maximised. The role of testing is to establish when someone becomes ill, when someone becomes symptomatic, whether they have coronavirus or not. Once you've established that an outbreak is in place within a care home, the actual management of that outbreak doesn't change no matter how many people that you test in the care home. It's very important to emphasise once again that the management remains unchanged in that scenario, whether you test the first patient and it becomes positive or the first 10 patients. The most important part is to make sure that the risk assessment of how those patients are shielded from the risk of infection and the infection prevention and control mechanisms that are in place within each one of those care homes are maximised to prevent further spread.
Okay, thank you, Gregor. Peter McMahon from ITV Border.
Thank you, First Minister. Can I just clarify, are you really saying that if you had tested more staff and more residents in Scottish care homes earlier, that it would have made no difference to the rate of infection and no difference to the rate of deaths?
I perhaps hand over again to the Chief Medical Officer, but certainly I do not have evidence that says that it is the case, that because the important thing in a care home is how, and we're talking here about coronavirus, this would be true of any infection, of how the measures you have in place to prevent infection in the first place, but when you have a case of infection, what then happens in order to ensure that the infection spread is minimised. That's why perhaps one of the most important things we did at the outset of this epidemic was put guidance, clear guidance to care homes around the steps they should be taking in isolation and social distancing. And that remains the most important thing with this infection as it is with all infections. But I've never equally tried to underplay the important role that testing has in different circumstances in the management of this, and the increasingly important role it will have as we come out of the lockdown that we're in right now. We have been candid about our capacity, about building up that capacity, and about how we then use the available capacity we've got in a number of different ways, and we continue to focus very much on all of these things. Gregor, do you want to add?
So testing undoubtedly has a role, but the most important aspect of testing is to confirm if there is a suspected first case within a care home, whether that suspected case is indeed coronavirus or not, because that then necessitates a very rigorous response within the care home to make sure that, as I said before, that infection prevention control mechanisms are absolutely maximised to reduce the risk of spread to other people. Health protection teams across the country have been linking with these care homes on a regular basis once they're establishing suspected cases to make sure that that testing takes place. There then is a really important phase which is about making sure that if there is a confirmed case, that any future cases there is the kind of pre-assumption that they are positive and that they're managed accordingly, according to the guidance, and make sure that they're isolated from other people. The guidance actually says that for the benefit of care homes residents, even before any cases are established, that whole aspect of isolation is a really important aspect of making sure that they're shielded and because of their kind of additional degree of vulnerability. So any additional testing doesn't really add anything, doesn't change the management within that care home thereafter.
Can I just say another point, because I'm standing here day in and day out trying to answer these questions on the basis of the evidence and the advice that we have. But I think it's a point worth noting as well, and it's a difficult point to make, but it's an important point. We're dealing with a new virus, one that has no treatment, that has no vaccine at this stage. We are learning about it every day that passes right now. So while I'm giving you answers on the basis of evidence that I have and sometimes evidence that I don't have, we are not close-minded in any way to adapting and changing our approach as we learn more about this virus. And I'm not talking peculiarly here about testing, I'm talking in general terms. We are in a fast-moving situation where the knowledge of this virus is developing every day, and it's really important for governments not to get stuck in fixed ways of doing things and be prepared to adapt and be flexible and respond. And that's what we're trying to do on an ongoing basis, and I think it's what governments everywhere are trying to do. Can I go now to STV News? I think it's Ross Govins, but I'm not 100% sure who it is on the line.
Yes, First Minister, it is Ross Govins. Colin Mackay had some technical difficulties. Can I just ask how quickly you would expect to get this increased testing regime into the care home sector? And is there a danger with a quarter of the deaths? We've heard so much about protecting the NHS being overwhelmed. Is there now a danger that the care home sector could be overwhelmed?
Firstly, the testing point, we will be moving as quickly as possible to expand testing to the point that I spoke about today, that all symptomatic patients will be tested, and that will be an ongoing endeavour. On care homes, we are working really hard to support care homes with infection prevention and control. So I gave a figure of 433 for the number of care homes in Scotland right now that at some point since this virus started to spread in Scotland have had cases of it. These will not all still have cases of it, but that's the number that have had. That's roughly 40% of all care homes in Scotland. So there's a significant chunk of care homes that haven't had this virus yet, and the focus there of local health protection teams with care home providers should be to prevent as far as possible infections occurring. Where care homes have had it, preventing the further spread is really important. So nothing about this is inevitable, and we must be absolutely clear that our jobs are to try and slow the job we're all being tasked with right now by following the public health guidance. All of our work is to slow the spread of this virus as much as possible. We know that a virus like this spreads easier and faster in institutions, whether that's hospitals or care homes, as we're talking about right now. So there is a particular need to focus hard on these infection prevention measures. I would expect to see the figures we have announced here today rise, unfortunately, but making sure we are doing all the right things generally as a population and within the care home sector is vital to making sure we limit that spread as much as possible. Lisa Summers from BBC.
Yeah, could I just get some clarity on one thing? And that is just, I think this is what you're saying, that we have heard, of course, the Health Secretary for England, Matt Hancock, saying that he wants to move to everybody in a care home being tested. That's not something that you want to do here. But my wider question really is that we're now seeing figures today which suggests that 40% roughly of all COVID-19 deaths are in the community. Given our hospitals have the capacity, should we not be doing more to make sure we try to get GPs out to see these patients or get patients into hospital and treat them there and then give them a better fighting chance of recovering?
Well, on the issue of where a patient who has the virus or is suspected to have the virus is best treated, Gregor is more qualified to talk about that than I am. I'll hand over to him in a second. But as I've said before, that should be down to clinical decisions about what is the best treatment for patients. And if that is hospital, then whether that is a care home resident or anybody else, hospital is where somebody should be. If the judgment is that is where they'll get the best treatment. For some people, staying in their own home or for a care home resident, the clinical judgment will be they are better cared for where they are. But that is something that must be driven by clinical judgment. And Gregor's touched already on the relationship between GPs and care homes, and he will want to say, no doubt, more about that. On the issue of what Matt Hancock has said, it's not for me to speak of another government's announcements. I have heard briefly what Matt Hancock has said today, but it's obviously for him to set out the detail of that. Just in terms of testing all symptomatic patients as opposed to residents, as opposed to all residents, one of the points I've made very often at this briefing, of course, and again, Gregor can amplify this, is that the test is not effective for people who are not showing symptoms. It won't give you a reliable result to tell you whether you do or don't have coronavirus. So that's why if you test somebody when they're not symptomatic, even if they're in the incubation period, it may not give you a reliable result, and it doesn't also tell you that you've had it once you've recovered. So the importance of testing people when they are symptomatic is very much about the reliability of the information that testing gives you. Gregor.
So the decision as to whether to admit someone to hospital or not is very complex, and it relies upon what type of treatment that person needs, and whether we're talking about that consideration during the time of an epidemic or even beforehand. GPs make these decisions on a daily basis and always have done as to where the most appropriate place and the most appropriate treatment for that person to receive can take place. And you're right that there is some capacity within hospitals just now, but that doesn't influence the decision as to where people receive the most appropriate type of care. And today, tomorrow, next week, GPs across this country will continue to make decisions based on the clinical needs of those individual people and what treatments they're able to offer them in each environment that they are in, whether that be their own home, whether that be a care home, or whether that be in a hospital bed. It depends on what is the best suitable treatment for those individuals.
Okay, thank you. Smith from Bauer.
Good afternoon, First Minister. Just a question in regards to mortuaries. We're seeing plans now in several local authority areas for temporary mortuaries. So I was just wondering if you could provide us with an update on mortuary capacity in Scotland, whether or not we're close to that capacity, and if you think it's likely that these temporary mortuaries will be needed.
We are not, Gregor may have more information, we can certainly provide more information rather than give partial answers on the statistics right now. All parts of Scotland will be preparing as part of their contingency, are preparing, just as health boards are preparing for hospital capacity and ICU capacity. Others will be preparing to make sure that mortuary facilities are available. I don't have the figures to hand about what the utilisation of that capacity is thus far, but I come back to the central point on this, that all of our efforts here are to reduce the number of people who die from this virus. It is, as I said a moment ago, it's a new virus. There is no treatment for it and there is no vaccine. And therefore, unfortunately, we are seeing people lose their lives from it. But all of what we're asking the public to do and all of the planning that our health board, local authority and other partners are doing are about to try to reduce that as much as possible, which is why the centrality of the key message remains as vital. Do you want to say any more on mortuary services at the moment?
So I don't have any up-to-date data on that either, so we'll seek that and pass that on.
We can provide that later to you. Oliver Wright from Central FM.
Thanks a lot, First Minister. You said a bit earlier that the new measures for self-employed people will be in place no later than the end of the month. That's 2 weeks away. Is that going to be fast enough, given that some of these self-employed people might have had no income for up to a month at the moment?
Look, we're trying to get it in place as quickly as possible, and I absolutely understand how urgent this is for businesses. And so what I'm about to say doesn't offer much comfort in that respect, and I realise that. But in order to disburse money to eligible businesses or individuals, we have to have processes in place to check eligibility and physically to get the money to them. And it does take a little bit of time to get those processes in place and be sure that they're working reliably. Now, these things are happening much more quickly now than they would in normal times, and there's perhaps lessons for all of us in that for the future, but it still does take a little bit of time. So by the end of this month at the latest, but we will accelerate and do that more quickly if it's at all possible. As I said earlier on, with the announcement today, the package of support that we're now providing businesses is in excess of the consequential funding that we have had. So we're helping businesses to the maximum of the financial capacity we have right now, but we will continue to listen to businesses to try to find ways of addressing the concerns that they have and to do that as quickly as we possibly can. Jack Foster from Global.
Good afternoon, First Minister. Last night, the Scottish Government admitted to us that it was still working on how it would extend PPE provision to what it called the unregulated social care industry. That was in response to an open letter by Spain, who represent employers of unpaid and personal assistant carers in Scotland. They say they've been abandoned and forgotten about by the government when it comes to personal protection. Given that, how has the Scottish Government managed to forget such a large portion of social care workers in its preparation for an event like this? Hundreds are saying that they've been turned away from your PPE helpline because they're not registered social care providers. You said just last week that the helpline was open to everyone. Why then are so many still being left without and exposed and vulnerable?
I'm going to hand over to the Health Secretary to say a bit more about this. Obviously, she's overseeing the distribution of PPE overall. But can I say, firstly, before I do, just something I don't want anybody to feel forgotten about, left behind, or abandoned in this. And it's really important that we make that clear. I read the open letter that you had, or the details of the open letter that I think you'd reported online last night. We have big logistical challenges here. I don't say this to ask for sympathy from anybody. It's our responsibility to do this. We have pressures on supplies. We are trying to maximise supplies and get them to where they are needed. We have had to prioritise the regulated sector in the NHS, but we understand there are needs beyond that. You're talking about the unregulated sector, which is really important, but wider public sector needs as well. So I don't want anybody to think that we have forgotten about any of this. We are seeking to work our way through this as quickly and as efficiently as we can. But Jean will give some more detail on exactly what is underway.
So there are two particular groups here. Both of them are important. The personal assistant group, which are those individuals who do a really important job for individuals who need care and support in order to live as independently as they possibly can and as they want to. The personal assistants are employed by the individuals concerned. There is, to some extent, a way by which we can reach those, and we have almost finalised this, to provide that PPE because they are a clearly identifiable group. They come together through SPIEN and others that would allow us to find that more direct route to understand their needs and to make sure that we can deliver according to their needs within the overall PPE work that we're doing. Unpaid carers are equally important, but a harder to reach group because it's a group of individuals. So we are trying to work through the organisations that represent their views. That won't cover everyone, though, but trying to work through the organisations that represent their views as unpaid carers to us on a range of issues about carers. I understand it very well from my time as Minister for Social Security, to see if we can find a straightforward, reliable route that also has proper diligence behind it to get what those individuals need to them as individuals. The most likely way that that will happen is through those hubs that we've spoken about before in each locality. But we're finalising that just now. I would expect that even as we do that, there will be some individuals that we'll miss. And again, we will try and make sure that they know the direct way to tell us that we've missed them out so that we can respond quickly to their needs. But I intend that over the next 2 or 3 days, we will have finalised the situation for personal assistance and, if not finalised, be very close to having finalised what we do for unpaid carers.
Thank you. Neil Pooran from PA.
Thank you. On testing in care homes, can you confirm if all symptomatic staff of care homes will be tested as well for coronavirus? And also if patients who are returning from a hospital to a care home, will they automatically be tested for coronavirus as well?
I'll hand over to the CMO in a moment, but in terms of staff, what we are seeking to do and are in the process of doing with health and care staff is not just for staff who are isolating because they are symptomatic, but also where a staff member is isolating because they've got a family member who's symptomatic, is get testing there, and we are increasing that, and yes, that would include care home staff who are symptomatic to check whether they've got the virus and have to isolate or whether they can safely go back to work. The issue I'll particularly hand over to the CMO on is this question of people coming from hospitals into care homes, and we want to make sure that testing is used to the maximum to provide confidence. One of the things that I'm always conscious of, and as a layperson on these things, want to try and make sure we understand, is that while testing is really, really important, we've got to caution against allowing testing in some circumstances to give us false assurances. Because if somebody coming from a hospital, and I should say, and Gregor will correct me if I'm wrong here, but somebody coming from a hospital who has had COVID and has been in hospital for that will be tested and have to test negative before they're discharged. More widely, if somebody is tested and the test is negative, and we wouldn't want a care home to get false assurance, because if that person happened to be in the incubation period, the test is not necessarily reliable. So these things are being carefully thought about right now. We want to maximise the use of testing, but we don't want inadvertently testing to lead to any suggestion that some of these other measures, the really important measures around infection prevention and control, are somehow less important because you've got a test result, particularly if that test result in some circumstances could give you false assurance.
We need to be very careful that we don't see testing as the panacea to all the challenges that we face in relation to how we protect that most vulnerable group of people in our care homes. And in relation to discharge from hospital, I think that there is a very real risk that actually by testing those who are asymptomatic on discharge from hospital to care homes, we do create a sense of false reassurance that actually everything's okay, when actually the reality is that we know that anyone can develop those symptoms within that 14-day period. The most important aspect, and I go back to this point, the most important aspect for all of these people is to make sure that they are treated as individuals, that there's a risk assessment which is properly done to make sure that everything which can be done to protect not only themselves but those other residents in terms of infection prevention and control is put in place as soon as they make that passage from hospital discharge back into a care home.
Thank you. Libby Brooks from The Guardian.
Sorry, hello, First Minister. The statistics from the NRS seem to be indicating a similar trend from last week, in the sense that there were more non-COVID related deaths than the 5-yearly average. And I was wondering if we were going to get any more detail on those. It was 261 in the last week. Any more information about them, and whether the interim CMO might be able to offer his thoughts on why there was that increase above average.
I will hand over to Gregor. We're not able to give further information on that today. This is still something that is being explored, but we do hope to be able to, in the near future, to give some more thoughts as to what is behind that. What I would say, last week we had a big proportion of what you would call excess deaths, so the number of deaths in that week that were higher than the average of the last 5 years for the similar week. A bigger proportion than is the case this week were not explainable by COVID. The majority of the gap between the deaths in the most recent week and the 5-year average in this report are attributable to COVID, but there is still a portion that are not, and it is really important that we do understand that, and that's work that is ongoing. But Gregor can maybe say a little bit about that, and also this global phenomenon of this as well.
So I agree that gap that suggests there's certainly an excess of deaths over what we would expect as an average is certainly still evident there. And as we said last week, there needs to be further work done to try to understand exactly what contributes to the nature of that gap. And there's a variety of different contributions which probably all factor together to kind of create that larger figure that we've all seen. I would emphasise again, this is a phenomenon that we're seeing right across Europe, and in the figures that were presented this week by England, they were able to identify that there's a similar excess of deaths that they're seeing as well. So this is something which I think as a community we need to come together to better understand. And as I say, I think it's very, very likely that we will see that there are a variety of contributing factors rather than one single factor which is producing this very clear excess over what we would expect.
Thanks. Mark McLaughlin from The Times.
Hello there. I wanted to go back to this issue of the exit strategy. Now, I want to read two statements from Jason Leach, who I've got the utmost respect for, by the way, so I'm not trying to catch him out, I'm just trying to follow the decision making here. So on the 10th of March, and this was around the time he was advising his wife to go to the Stereophonics gig, he said, "We have got to time this right, so you want to gradually increase the number of people infected over a very controlled period so we get herd immunity." Yesterday, he said, "Herd immunity was never a phrase that any of us liked. We literally don't know if that will be the case, that herd immunity will happen. It's often how viruses behave at some level. That will be true of this virus, but it's not an outcome we're trying to get to. What we need is a vaccine. Until a vaccine emerges, what we need to do is manage this virus." So I think what he's saying is that there's no longer some kind of slow race to this 60%. Does that mean that coronavirus is going to become the new normal until they find a vaccine, which could be 2 years away, and we're going to have waves and waves of lockdowns and all these restrictions?
I'm going to say something that is the kind of thing politicians in normal circumstances don't like saying. I don't know for sure what the answer to that question is. But coronavirus is not simply going to go away. And that I think we know for certain. And we know that herd immunity has become one of these phrases that I think is often talked about in misleading ways. But herd immunity is what you can get through a vaccine, for example. So we know a vaccine is still some time away, although hopefully not that far away. So we are going to have to continue to manage and suppress the virus for some time to come. Now, what I hope we will be able to do over the coming days is start to share much more with the public of the factors and process that we will go through to make those decisions. You know, so what is it we need to see in terms of the spread of the virus before we could start to think about lifting these measures? Obviously, we want to see transmission suppressed as much as possible, hospitalisations, ICU numbers and deaths falling. What then could you look to do in terms of lifting some of these measures? What impact would that have on the spread of the virus? Are there some measures you could lift earlier than others, or are there different stratifications you could have? And please don't take this as decisions. These are the different factors that come to play. You know, could you have different approaches for different groups of the population, or different kinds of business, for example? So these are the kind of things that we are starting to think through. But we still will have to suppress this virus. And so if we are not doing that to the same extent through lockdown measures in the future, we will have to find other ways of doing that until a vaccine becomes available, or treatments become available that allow us to do that. And that is where we are looking very carefully at how you potentially do that, at least in part, through what's called test, trace and isolate. So how you go back into a situation of trying to contain the virus. So there are no definitive decisions yet around these things. I want to stress that. But these are the thought processes and work that we are now doing. And as I say, over the coming days, I want to be able to be much more open and share some of those thoughts and considerations with the public as our thinking develops and as we reach the point of taking particular decisions. Gregor, do you want to add a bit more around the issue of what a vaccine does and the 60% point that Mark raised?
So I think we're all coming to the realisation that coronavirus is here, and it's here to stay with us, and we need to find ways of being able to deal with that in the longer term, not the shorter term. And we've done the same in the past when you think about it with flu vaccine, with flu, because flu is one of those other very dangerous circulating pathogens that actually has just become endemic in our society, and that comes around on a cyclical basis, and we need to be able to respond to that in a way that takes a different type of approach, a different countermeasure to try to make sure that we reduce the risk of harm to people in our society. And I think we'll come to the same position over time with coronavirus. Now, at the moment, the tools in our armoury are to make sure that we suppress that disease down as far as possible to protect those that are most vulnerable. But in the future, I can foresee a time when we'll be taking similar approaches as we do currently to flu, and we'll be looking to other mechanisms to try to make sure that we safeguard people in our society. And some of that will be about the development of new approaches and medicines, and some of that will be about the development of vaccines. But we need to make sure that we're getting there first, and to get there first, we need to take these unusual and quite severe measures to make sure that we kind of protect those who are most vulnerable in our society in the meantime.
Tom Peterkin from P&J.
Good afternoon, First Minister. The PPE distributor, Sam Goldbowles, has said that PPE was collected by Public Health England and this should go to English care homes. And there seems to be guidance from the UK government backing that up. Can I ask, what exactly is the arrangement? Should Scottish care homes get access to these stocks, which have been stockpiled for flu pandemics?
I'll ask the Cabinet Secretary to give the sort of up-to-date position on this. When we talked about this yesterday, we understood we were talking about stocks of this and other companies going direct to being sold direct to care homes that were over and above the national stockpile. Today it appears to be that it is about distribution of the English national stockpile, but we're obviously still working to get to the bottom of this and make sure that any concerns are addressed.
So as the First Minister said, it is a little bit of a moving picture. We had understood it was of a particular shape, if you like, yesterday. The concerns that were raised by Scottish Care was that orders that were due by their members to be delivered in Scotland had been diverted elsewhere. Now, as it happened later on yesterday, the Secretary of State for Health, Matt Hancock, assured me that if that was happening, it was not at the direction of the NHS in England or Public Health England or his own department. Subsequently, there was more information that appeared to suggest that it might be, and I wrote again to Mr Hancock to ask him to help resolve what appeared to be a contradiction. What now appears to be the case, certainly from Gompels, is that what they have been asked to do by Public Health England or by the NHS in England, it's not quite clear, is to distribute their own pandemic stock. That is a different situation. We have our own pandemic stock here in Scotland. Our National Procurement Organisation, NSS, holds that. It distributes that. So we're still trying to be absolutely sure that we've got to the bottom of this, that we can provide a reassurance to the members of Scottish Care that their normal PPE providers and suppliers will continue to take their orders and to supply them, and that as we have arranged, we will provide top-up PPE to those individual care homes, given that they have a greater demand on PPE than would be the case in normal circumstances. So that's where we are right at this point. We continue to try and just bottom out exactly what the situation is. My primary concern is that our individual care homes across Scotland continue to be supplied by their normal suppliers, and that I make sure that the top-up arrangements from our national stockpile is getting to them directly when they need it in order to augment the supply of PPE they have, because it is so critical to the infection prevention and control and the protection of residents and staff.
Michael Blackley from the Mail.
Hi, good afternoon. The figures that you've revealed today very much illustrate the scale of the health emergency that care homes have been facing in recent weeks. Can you confirm exactly what additional funding you've provided to councils to help care homes deal with this? And also, just to pick up on an earlier question about the timing of expanding tests to all care home patients with symptoms, any indication at all of how long this will take? Are we talking days, weeks?
On the latter point, we will start that process now. I want to see that happen quickly over a period of days, and we'll give further updates as that progresses. On the issue of funding to local government, we have an ongoing dialogue with local government. We have made clear to local government that they should act to do what's right to deal with the virus, not be constrained by funding issues. But I'll hand over to the Health Secretary to say a bit more about the state of those discussions.
So, as the First Minister says, that is absolutely correct. Very early on, we made it clear to the Convention of Scottish Local Authorities and through them to individual local authorities that the funding constraints should not constrain them in looking to do what was needed to be done in the provision of social care. And in terms of the arrangements with care homes, there is a national contract arrangement between care home members through Scottish Care and COSLA, and the agreement that has been reached between those two bodies is a 3.5% uplift to the funding that is provided to care homes. So we've put in place with our partners in local government the arrangements that we believe are necessary, that we've been advised are helpful to them and to care home members, and we continue to have those discussions. I think I've said before at these briefings that I talk with COSLA at least once a week and with Scottish Care at least once a week in order to be sure that we are listening to and responding to any emerging concerns that they continue to have.
Simon Johnson from The Telegraph.
First Minister, you said that this virus travels faster in institutional settings. What is your message to families who look at today's figures and see 25% of deaths occurring in care homes and 13% in non-institutional settings? They're now seriously considering taking their relatives out of care homes.
My message to families is really, as I set out in my opening remarks, firstly to understand absolutely the additional anxiety that they will be feeling right now. Always, I know, an anxious time to have a relative in a care home, but that is obviously much more acute right now, given what we are all facing with this virus. But secondly, to reassure families that we are doing everything that we can and will continue to do so, working directly with care home providers, with local health protection teams, with public health directors in health board areas, and of course through the care inspectorate to make sure that the appropriate steps are being taken, and we've covered some of them already today, to prevent infection and to manage any outbreaks, with the protection of residents the absolute priority in this. I personally chaired a lengthy session yesterday with these organisations and partners I've spoken about, making sure that we are assuring ourselves that the right things are happening. Gregor, as CMO, had a conversation involving public health directors last night. We will continue to do everything we can to support care homes in what we know is probably the most challenging situation that any of them have dealt with. Tom Martin from the Daily Express.
Hi, good afternoon, First Minister. Just of the 129 deaths in homes or other settings, I just wondered how concerned are you that people are not seeking or not getting the appropriate clinical care or help from the NHS?
I'll hand over again to Gregor, who can answer this from his own perspective as a clinician. But I guess I would say, and Gregor will correct me if I'm getting this wrong, that just because somebody dies in their own home doesn't necessarily mean that they haven't had clinical support and help. Some people will choose to stay, or it may be the clinical judgment that is best for them to stay at home. So I wouldn't read from these figures an assumption that these are people who haven't sought help from the National Health Service. More generally, aside from coronavirus, Gregor and I have both spoken at past briefings in recent days about the importance of people with other kinds of symptoms that are not coronavirus related of coming forward and seeking help, because the NHS remains open and we want people with unexplained symptoms that they're worried about to come forward and get that help. Gregor, do you want to say a bit more about the circumstances of people sadly passing away in their own homes?
I know that up and down this country, from the conversations that I've been having with clinicians, that there's some really difficult conversations that are taking place between people, their families, and the clinicians who are looking after them as they decide what their preferences are for their care, where those preferences for their care should take place, and actually what the expectations about their care might be as well. Those are really challenging conversations to have, and I'm confident that they're being done in the correct manner, and that they're being done in a way that are sensitive to what the expectations of treatment might offer, but also what people's preferences about their future actions have as well. So I don't think that we should read too much into the kind of place of death in terms of people dying at home. I suspect that those are occurring because those conversations have taken place in the sensitive manner which I would expect to happen between clinicians, patients and their families.
Thanks. Vivian Aitken from The Record.
Good afternoon. I know you said that clear guidance has been given to care homes to manage the crisis, but we've already heard that many care homes have had multiple deaths. Clearly, some of them aren't listening. What are you going to do to make them listen? Is there a possibility that the Scottish Government will step in and take control of care homes who are found to be failing? And can I also ask, just a figure that I didn't quite catch, you said 433 care homes already had people who had coronavirus. Did you say that was 40% of the total?
So that's around, there's just over 1,000 care homes in Scotland. I should say, I think I said it at the time, but that is the number of care, the Care Inspectorate will be publishing that figure through the Scottish Government on a daily basis now. That's the total number of homes that have reported cases since the start of this outbreak. It doesn't mean that all of those homes currently have cases. We do hope over the next few days to also publish information on the number of care homes that have, excuse the expression, an active or live outbreak within their care home. So we're trying to provide as much information as possible in as real time a basis as possible. On the issue of care home providers, of course, have the primary responsibility for ensuring that infection control procedures are followed in their care homes. The Scottish Government, the Care Inspectorate, local authorities, health protection teams have got a supportive role to play in that, and that is really important at all times, but particularly times like this. We had discussions just yesterday about how the Care Inspectorate is making sure that appropriate inspections are taking place and the appropriate follow-up is happening should care homes, and I hope this is not the case, not be following the guidance that we consider that they should be. I'll hand to the Health Secretary to say a word or two more about that.
This partly relates to what both the First Minister and Dr Smith said at the outset about how we harness and ensure that the primary care support, the health protection teams, now under the leadership of our Directors of Public Health locally, will ensure that individual care homes understand the guidance that was issued some time ago, are actively following that guidance, that they have live infection prevention and control training and measures in place, that the staff who are working so hard in those care homes have the confidence that they need to understand everything that they need to do to protect their residents and themselves, and that they have the right PPE to allow them to do that. We've touched on that earlier. So all of that will come together in order to provide two things, both additional support to care homes where that is needed, to protect those care homes that have not yet experienced a case of COVID-19, to try and ensure that they do not, and to provide additional support to those who have experienced a case or an outbreak of cases in order to ensure that they have everything they need to make sure that that is not an experience that is repeated. And the Care Inspectorate, through their direct inspection regime, will provide another arm of assurance to us, along with the data that we've already said we will be gathering and making sure that that is available to the wider public.
Thank you. Tom Gordon from the Herald.
Hi there, First Minister.
Hi.
Can I just check, you said that you are only just now moving to testing all symptomatic patients in care homes. Is that what you said, yeah?
Yes.
Well, what have you been waiting for? Because that suggests you haven't even tested all the 433 care homes with that have reported cases.
I'll go through this again relatively briefly because we've set out in some detail the position here already in the course of today's briefing. So one of the things, of course, is we have been building up our testing capacity to make sure that we can do more testing. So that's one of the things that we have been doing and continue to do. But it is already the practice and the expectation that in every care home where there is a suspected case of coronavirus, the first cases of that are tested in order to establish whether the virus is in the care home. And then after that, the infection control procedures are in place, and that is the most important thing. Moving to testing all symptomatic patients, this is advice that is coming to me from the Chief Medical Officer, so I'll hand over to him so he can put it in his own words. But that is not going to change the clinical management of cases in care homes, because the way in which they are dealt with should be as it has always been. But we recognise that there is a feeling from families, from staff, from relatives that they want that certainty in, given the vulnerability of people in care homes, that they have it or not, and that's why we're moving. But this is not about changing how an outbreak would be dealt with in a care home, because that is down to the kind of infection control and the procedures that we've been talking so much about. Gregor, do you want to add?
So the key thing about testing of whatever test a clinician decides to undertake with a patient is how will it start to alter the management of that patient, and does it influence what you would do next? And the consistent guidance from health protection teams right from the beginning, in fact from even before we had our first cases in care homes, was that actually yes, it was important to establish whether coronavirus was in the care home or not, and whether there's an outbreak that's currently in play. But beyond that, once you've established it, the only reason why you would ever begin to undertake any more tests is if there was any clinical doubt as to whether that person had coronavirus or was being affected by anything else. And that option has always existed for clinicians to be able to do that if there was clinical doubt. But please be very, very clear, the actual process of managing an outbreak isn't altered at all by the fact of whether you test the first person, the first 10 people, or the whole kind of person. The outbreak still needs to be managed in exactly the same way, and that's by scrupulous attention to infection prevention and control, proper risk management of those patients within it, and actually escalation of treatment as it becomes necessary for any particular reason.
Christine Lavelle, no, sorry, my apologies, Muir Dickey from the Financial Times.
Thank you. I wanted to follow up on the question of the setting of coronavirus-related deaths. So you made the point that there's clinical decisions made about whether people go to hospital, and it's certainly no bad thing for people to be able to die outside an institutional setting. But is these levels, 25% of deaths in care, 13% non-institutional settings, are they unusual for viral infections? Are those the sort of levels that we would expect to see for flu infections in normal times, for example?
Chief Medical Officer is best placed to answer that. I would say there is, on coronavirus in particular, we are now seeing some emerging evidence from other countries, and we're paying very close attention to this, that a higher proportion of deaths, maybe 40 to 50%, may be happening in care homes rather than in hospitals. But that's specific to coronavirus. On whether this would be a standard pattern for other viruses, I don't know whether Gregor's able to answer that.
So I couldn't give you a definitive answer on that. All I can tell you is that we're constantly learning about this virus and the patterns of the way that we're trying to treat it, and that there are networks who are constantly collecting data for us to better understand not only how we're managing it in this country, but how that compares to international experience as well. And we'll continue to do that over the course of this epidemic so that we can learn from that and make sure that the approaches that we're taking are actually the best approaches that we can employ.
And now Christine Lavelle from The Sun.
Hi, First Minister. There was a significant effort to get people out of hospitals at the start of the pandemic, which resulted in a lot of older people being moved into care homes. I just wondered, do you know how many, and have you looked into whether this has led to the virus spreading from hospitals into care homes?
I'll hand over to the Health Secretary. There has been a very sharp reduction in delayed discharge. Again, the Health Secretary can give more detail of this. A significant number of those have been discharged to their own homes, although there will, of course, have been some that have gone to care homes. But the Health Secretary can say a bit more about that.
Up to date, there have been just over 900 people who would otherwise be classified as a delayed discharge, discharged from hospital, primarily, as the First Minister said, to their own home. What delayed discharge means is that the individual no longer needs the level of clinical care that hospital is providing. And so the quicker we can get someone out of that hospital setting when it is no longer needed for their clinical care and their health, into either a care home if that is the right place for them, or more often to their own home with a package of care and support, the better that is for individuals. And so the reduction in the number of delayed discharges that we've seen is a very positive result as part of the significant effort that has gone on by our health and social care partnerships, by social workers, by care providers, in order to ensure that people can leave the hospital setting, return home with additional support if that's what they need, or enter a care home with all the provisos that the First Minister and Dr. Smith have already outlined in that regard, so that they no longer need to be in that clinical setting. Because one of the things we know is that if you stay longer in hospital than you need to for the condition that caused your admission in the first place, then particularly with older people or people who are more frail, you lose muscle function, you lose a degree of mobility, and so we want to avoid that as far as possible. So that significant reduction, over 50% reduction in the numbers, and we continue to work to bring that down even further, is a very positive set of figures for the individuals themselves, as well as for the use of our hospital facilities.
Paul Malik from the Courier.
Good afternoon, First Minister. I was just to go back onto the figures that were released by NRS this afternoon. The Chief Medical Officer noted that this was a European-wide phenomenon. How is the Scottish Government investigating these additional deaths, the 261 that were recorded this week, that haven't been explained by coronavirus or attributed to coronavirus? I mean, are you working with European partners? Are you working with the UK government on this? Is this that's been investigated further to the fullest extent? And secondly, what impact will this have on any sort of lockdown exit strategy? Will we need to wait for these unexplained additional deaths to go down before we can start considering removing the way that we're living at the moment?
Not necessarily is my answer to that, but that's a more complex answer that we'll come back to in future days. But I'll ask Gregor to answer the point about how we will be going about exploring this issue.
So there are very well-versed procedures and networks that are currently in play to better understand this. And your point about how we link with partners across other European countries is really important, because there's a very strong clinical network that exists there across our health protection teams to share that learning. And in fact, it's something that we do on a regular basis anyway. We very often see an excess of deaths coming in, particularly over the winter months when there may be other viruses like flu circulating. And so those procedures which are put in place to better to understand what's contributing to those deaths are already there and very well established. All that's happening now is that data analysis is taking place, those conversations, linking up with colleagues from other countries to better understand what their picture is, are all happening within those networks, and over time and the coming weeks we'll get a much clearer picture of exactly what's contributing to that.
Okay, thank you. And last question today comes from Chris McCall at the Scotsman.
Good afternoon, First Minister. I'd like to return to the subject of lockdown and the debate over an exit plan. Given the wide geographical disparities we've seen in rates of infection across the country and the NRS statistics released today, does that mean we could potentially see different parts of Scotland, such as island communities, for example, easing restrictions quicker or before our biggest cities?
I'm not really able to say more about that yet than I already have done, not because I'm trying to hold anything back, but because we are still at a reasonably early stage of looking at the options, because the most important thing right now is making sure the lockdown is having the effect in suppressing the virus and getting the evidence of that. But yes, we are starting to think about the different options, and we have been thinking about the different options for coming out of this when that is appropriate to do. And that could be different measures at different times. It could be different groups of the population at different times. But these are all ifs at the moment. We've got to look at a number of things around that, what any approach would do in terms of spread of the virus, the practicality of things, the ease of reintroducing things if we suddenly decided that was necessary. And of course, the simplicity of messaging. I've said before, and I've said this in a UK sense, and I certainly think it in a Scottish sense, that none of this is simple, I should say, but the simplest way of telling people what they need to do is if we're giving the same message to people in every part of the country rather than having geographic variations there. But if the evidence tells us we need to do something different, then of course that's what we'll do, because we need to do what is required. And that's why over the days to come, as we develop our thinking on this, I want to try and share in as much public discussion as possible about the factors and considerations that are in play and the different judgments that we will have to reach, because none of it will be straightforward. And for some time, all of it will be involve asking the public to live their lives in ways different to what we are all used to. So we will continue to be open about this as our thinking develops. But my last point would be, I don't want to, although I know how keen everybody is to hear decisions around this, I don't want to get ahead of where the evidence allows us to be in trying to speculate about exactly what might be happening. That concludes the questions today. Can I thank all the journalists as usual, and thank all of you at home for watching. These briefings are always difficult, I'm sure, to listen to. I think that's been particularly true today, but it's important that we share this information, that we understand it, and that we also share and that you can hear us being questioned on the different things we're doing to achieve those objectives that we're all trying to achieve right now. Slowing the spread of the virus, protecting the health service, and also reducing the number of people who die. And as I said earlier on, and say every day, we've all got a part to play in that. So thank you very much for the part you are playing, and we will see you at the same time tomorrow. That's not strictly true, actually. At this time tomorrow, 12:30, there will be another virtual session of First Minister's questions. So rather than being questioned by the media, tomorrow I will be answering questions from the opposition party leaders, and this briefing will resume as normal on Friday. Thank you for watching just now.